So, what's so interesting is occasionally we will run a more comprehensive cholesterol panel that has the NMR graph with all the different size particles.
Mhm.
And what we find is in that the LPIR is a little bit closer to more insulin resistant, but their fasting insulin is normal. So then we were always like, what does that mean? So it looks like you have the answer to that.
Yeah, and really, again, Dr. Kraft, Joseph Kraft, figured this out because when you look at the Kraft patterns, so there are five patterns that you can get on a Kraft test. And, two of the patterns that define insulin resistance, you actually start with a normal fasting insulin. So having a normal fasting insulin level doesn't guarantee that you're insulin resistant, that you're not insulin resistant. Now, if your fasting insulin level is elevated, that does show you that you're insulin resistant, but you can have a normal fasting insulin level and still be insulin resistant, when you do a full Kraft test, or now, like you said, the LPIR score will reveal that as well.
Yeah, and that makes a lot of sense because we tend to see the fasting insulin because someone's carnivore, they've been eating this way for a while. So now their fasting insulin has come down. And we were always perplexed with, well, that's interesting because their PIR score shows that they're still insulin resistant. So I guess that is more of a maybe a better marker to look at long term.
Yeah, I think so. And, again, you can then correlate this with things like visceral fat levels, which are, very strongly associated with insulin resistance. And, oftentimes I'm kind of putting all of these things together. I always tell people understand that there's no one test that tells you, am I healthy or not? And that's kind of the fallacy of the well, let's just look at your LDL cholesterol, and that's going to tell us everything we need to know about heart disease. I mean, it really is nonsensical. Heart disease is such a complex process. To think that one lab test is going to tell us everything we need to know, it really was just a silly concept to start with. Yet here we are, and most doctors firmly still believe that, just look at the LDL cholesterol and you're going to be able to tell if someone's at risk of heart disease or not.
Right. And it's so unfortunate because we see people turn carnivore. They're like, oh my gosh, all my symptoms are better. I'm sleeping through the night. I'm losing weight. I feel so much better. And then they go and do their blood work next to their total cholesterol or their LDL cholesterol. It says H. And they're like, my doctor says I need to get on a statin now and I need to change my diet. And even though a lot of their symptoms have improved, now they are so worried that they need to get on medication.
I was just going to say that really is unfortunate. And especially people who have, very strong reasons for, needing to do a carnivore diet.
Right.
For instance, they have severe autoimmune conditions that are really being benefited by this dietary approach. And they're basically scared out of it by their doctors who don't understand, what this number means or doesn't mean. Yeah. So, when we look at, our blood cholesterol measurements, HDL, LDL are the ones that people are going to be familiar with. And, we're told that HDL is good cholesterol and LDL is bad cholesterol. And again, that really, that concept is very flawed. Both HDL and LDL represent families of cholesterol carrying particles in the bloodstream. And, one of the ways to sort of further break down our cholesterol particles is by their size. And specifically, when we look at LDL cholesterol, this is most relevant for, we know that there are small, dense LDL particles, and there are large, buoyant, or large, fluffy LDL particles. And furthermore, what we know is that it is only the small, dense particles that end up in atherosclerotic plaques. The large, fluffy, large, buoyant particles do not get incorporated into atherosclerotic plaques. So, this is the problem with just looking at the LDL level as an overall level. We don't know, is it high because you have a lot of large, fluffy particles, which I would put forth as not a problematic situation. And even if your LDL level is what's considered low, in the target range, if you have a low amount of LDL cholesterol, but most of that LDL is small, dense particles, you are still at risk of heart disease. And this is why I see people ending up on my operating table, despite the fact that they've had low, well controlled in the guidelines LDL cholesterol levels for decades in many cases. And yet they still end up with heart disease. They still end up on my operating table.